Welcome to the deep dive. We're here to take complex info and, well, make it clear and usable for you. Today, our mission is to explore something really critical in livestock health, but often kind of hidden: plant poisonings in cattle. And here's where it gets particularly interesting. We're going to uncover how these hidden dangers can actually ripple through a whole herd. And they impact even the most vulnerable ones, the newborn calves, in ways you might not immediately think of. You probably picture pastures as, just green, safe places for grazing. But they can hold some surprising dangers. We're going to dive into the specific plants that can turn deadly. We'll look at the signs of poisoning, some subtle, some pretty shocking, and crucially, how that very first meal a calf gets.
Yeah.
How it plays this huge, almost unbelievably powerful role in its entire life. So get ready. You're about to get a real shortcut to understanding a topic with some pretty big economic and animal welfare implications. Okay, so this idea of toxic plants in pastures, it sounds simple maybe, but it seems like it's way more complex than just, avoid that plant. What makes these poisonings such a persistent and costly threat for people raising cattle?
Yeah, it's what's really fascinating and kind of sobering is just how widespread and devastating the impact can actually be. These toxic plants, they don't just cause like a mild stomachache, they can compromise pretty much every organ system in the animal. We're talking about the gut, the liver, the nervous system, even the skin.
Wow, okay. So it's systemic.
Exactly. And the timing, the severity, it's all influenced by a whole host of factors.
Mm-hmm.
Things like the season, what other forage is available, is there plenty of good stuff to eat? Also, how palatable is the toxic plant itself? Does it taste bad? And of course, where is it growing? Is it common in that region?
Mm.
And the financial fallout, it's massive. You've got direct animal deaths, sure,
Yeah.
but also abortions, lower productivity, kick less weight gain, less milk, and even birth defects,
Yeah.
just to give you a sense of scale. Those fungal toxins, mycotoxins, often found on feed, they alone are estimated to cost U.S. producers over $1 billion every year.
$1 billion.
Dollars.
That's an astonishing number. It really is like this silent threat just lurking there. You mentioned the whole dose makes the poison idea. How can the plant itself, or maybe the environment, crank up that danger level?
Right. It really boils down to that fundamental rule in toxicology. The dose determines toxicity. But the concentration of those toxic compounds can swing wildly, even within the same plant species. It depends on its growth stage, for instance. Younger, immature plants often pack a much higher nitrate punch.
Ah, okay. So younger isn't always better.
Not in this case. And sometimes it's just one specific part of the plant that's really dangerous, like the roots of water hemlock, incredibly deadly. Then you add environmental stress, things like drought or frost, or even just physical damage to the plant, that can dramatically ramp up the toxin levels.
So stress makes them more toxic.
Often, yes. And sometimes it's not even the plant itself that's the direct problem. It's these microscopic fungi living with the plant, like endophytes in tall fescue, or the fungi causing ergot. They produce the actual toxins.
Huh. That's complex.
It is. And then you have animal factors, too. Some species are just naturally more sensitive than others. And animal behavior, like if they're really hungry or the pasture's overgrazed, that can force them to eat plants they'd normally turn their nose up at.
Okay, that definitely paints a different picture of a simple green field. Right, let's get into the specifics then. The culprits. We've talked general threats, but what are the main classes of these plant toxins? And what kind of distinct, sometimes really shocking, effects do they have?
Yeah, understanding these different categories is pretty essential because they each attack the animal system in a unique way. Let's break it down. First, you've got nitrate-accumulating plants. Think common weeds like pigweed, Johnson grass, even things like oat hay sometimes. The surprising thing here is how it works. Nitrates get converted to nitrites in the rumen, and those nitrites basically stop the blood from carrying oxygen properly.
So they suffocate from the inside out, almost.
In a way, yes. A classic and pretty disturbing sign is chocolate brown blood because of this lack of oxygen. Often leads to sudden death. And a really key point, those nitrates don't disappear when you make hay. So contaminated hay is just as dangerous.
Good to know. Okay, what's next?
Then there are the cyanogenic plants. Think wild cherry, sorghum, Sudan grass. These contain compounds that quickly turn into hydrogen cyanide, prussic acid. This stuff rapidly shuts down cellular respiration, basically stops cells from breathing.
Sounds fast and nasty.
It is. The signs are acute, severe, rapid gasping breaths, really bright red mucous membranes, convulsions, and, sudden death, often within just an hour or two of eating the plant.
Okay, keep going. This is quite the list.
Next are the hepatotoxic plants. These damage the liver. Examples like ragwort and rattlebox contain something called pyrrolizidine alkaloids. These cause irreversible liver damage. And the sneaky part is the damage is often cumulative,
Cumulative, meaning?
meaning symptoms might not show up for weeks or even months after the animal starts eating the plant. It just builds up, leading to chronic liver failure down the road.
Ooh, okay. What else?
Neurotoxic plants. These mess with the nervous system. Water hemlock, poison hemlock, lupines, larkspur are in this group. They have various alkaloids that directly hit the central nervous system. You see muscle tremors, convulsions, staggering, uncoordinated movement. And in some really notorious cases, certain alkaloids, like the piperidine alkaloids in hemlock and some lupines, can cause birth defects, like crooked calf disease.
Birth defects too, man. Okay, what about kidneys?
Yep, nephrotoxic plants. Think oak, especially acorns or curly dock. These contain tannins or oxalates. The soluble oxalates bind with calcium in the blood, forming these tiny, insoluble crystals. These crystals can literally block up the kidneys, stopping urine flow, leading to acute kidney failure. And you often see low blood calcium, hypocalcemia, as a result.
Okay, are we nearly through the rugs gallery?
Almost. Photosensitizing plants.
Yeah.
St. John's wort is the classic example. They contain compounds like hypericin that make the animal's skin incredibly sensitive to sunlight. So in non-pigmented areas, white patches of skin, you get severe damage upon sun exposure. Redness, swelling, blistering. Really painful.
Ouch.
Then the cardiotoxic plants. Oleander, foxglove, yew. These are highly dangerous. They contain cardiac glycosides that basically interfere with critical heart function. They cause arrhythmias, heart failure, sudden death. Milkweed is another one. Contains different compounds, steroid glycosides, but causes severe neurological and systemic problems too.
Okay, last one.
Finally, just the general gastrointestinal irritants, things like castor bean, pokeweed, nightshades. They contain various irritants that just directly damage the lining of the stomach and intestines. Leads to symptoms like vomiting, diarrhea, abdominal pain. Pretty miserable stuff.
That is an incredible range of effects, from instant death to chronic illness, liver failure, neurological issues, birth defects. Given how incredibly varied these symptoms are, some mimicking other diseases, what makes diagnosing plant poisoning such a huge challenge for vets out in the field?
Yeah, this really gets to the heart of the difficulty. The clinical signs, as you said, are frequently very general, very nonspecific. They can look exactly like symptoms of common infectious diseases or other non-infectious problems like mineral deficiencies.
So it's easy to misdiagnose.
Very easy. Plus, you've got those toxins with cumulative effects like the swainsonine and locoweeds we talked about. Symptoms might not even pop up until weeks after the animal started eating this stuff. Makes tracing it back to the cause incredibly tough. You have to be a bit of a detective.
It sounds like finding the culprit is often harder than finding a needle in a haystack, really, and the stakes are obviously much higher. So, practically speaking, how do you actually make a diagnosis when you're faced with these tricky, varied symptoms? What are the steps?
It really demands a multifaceted approach. You can't rely on just one thing. It's like putting pieces of a puzzle together. First, clinical observation and history. A thorough history is absolutely crucial. You need to know the animal's age, when the signs started, what they might have eaten, pasture, hay, silage.
Right, the context.
Exactly. Then you look for those characteristic signs, though they might be rare. That dark chocolate-colored blood for nitrate poisoning or the bright red blood with cyanide. Those are big clues if you see them. But sometimes it's really weird. Like hairy vetch poisoning can cause this intense itching and skin changes over the entire body, even on black-hided cattle. It looks a bit like photosensitization, but it's way more severe.
Wow.
And conversely, some poisonings, like from buckeye or certain types of Bermuda grass issues, leave no specific lesions at all when you do a post-mortem exam. So the history and what you saw in the live animal become paramount.
Okay, so observation and history first. What else?
Feed and plant analysis. Especially for things like mycotoxins, chemical analysis of the feed is the most reliable way. Using advanced lab techniques like liquid chromatography, mass spectrometry.
Not just looking at it.
Definitely not. And that old blacklight test people sometimes talk about, it's pretty unreliable for most mycotoxins. Don't count on it.
Good to know.
Sampling the feed is also tricky because toxins like mycotoxins aren't usually spread evenly. You might have hot spots. So getting a good representative composite sample is vital. And another thing, just because feed looks moldy doesn't mean it's toxic. And feed that looks perfectly clean can actually be heavily contaminated. You can't judge by looks alone.
Okay, testing the feed is key then. What about testing the animal itself?
Right. Laboratory diagnostics on animal samples and the cropsy, the post-mortem exam. Blood tests can give clues. They might show organ damage like elevated liver enzymes. They could detect that methemoglobinemia from nitrates or the characteristic drop in calcium, the hypocalcemia you see with oxalate poisoning.
So blood work helps piece it together.
It does. And often, a necropsy is essential for a definitive diagnosis, especially if animals are dying suddenly. The findings can vary wildly depending on the toxin. Widespread hemorrhages and a fatty liver and aflatoxin cases, maybe. Characteristic kidney damage, tubular necrosis, and pigweed poisoning, or those unique inflammatory changes across many organs, granulomatous inflammation that you see with hairy vetch poisoning. The pathologist plays a key role here.
Okay, so after all that detective work, say you've identified a potential poisoning. What are the immediate steps? What do producers and vets need to do right away?
The absolute first, most critical action is always remove the animals from the source, get them away from that contaminated feed, out of that toxic pasture immediately, stop the exposure.
Stop a poison going in. Makes sense.
Exactly. After that, you might try gastrointestinal decontamination, usually involves giving activated charcoal orally. The idea is to bind the toxin in the gut and reduce how much gets absorbed into the bloodstream.
Does that work well?
It can help, especially if done early. Then supportive care is often crucial. Giving intravenous fluids, electrolytes, managing symptoms, basically helping the animal's body cope while it tries to clear the toxin.
Right. Are there any specific antidotes?
For a very few, yes. We have methylene blue, which works for nitrate poisoning. And for cyanide poisoning, there's a combination treatment using sodium thiosulfate and sodium nitrite.
But only for those specific ones?
Right. For the vast majority of plant poisonings, unfortunately, there's no specific antidote. Treatment is primarily just supportive care, trying to manage the damage. And, like we mentioned with hairy vetch, sometimes there's just no known effective treatment at all. The fatality rate for that one is typically really high, like 50 to 100%, grim.
That high fatality rate really hits home why treatment is often so challenging or even impossible. Given those difficulties in diagnosis and the often grim outlook for treatment, it just screams that prevention has got to be the best approach, right? So how can producers proactively manage their pastures, their feed, to try and minimize these risks in the first place?
You absolutely nailed it. Prevention is paramount. It really is the best medicine here, and it requires a multi-pronged strategy. First off, pasture and forage management. This really starts with walking the pastures regularly, knowing what's growing out there, identifying and, where possible, removing known toxic plants.
So weed control, basically.
Yes, but targeted weed control. And crucially, avoiding overgrazing. Because hungry animals, animals without enough good forage, are far more likely to take a chance on less palatable, potentially toxic plants they'd normally leave alone.
Makes sense. Provide better options.
Exactly. Providing alternative, safe, non-toxic forage can also reduce consumption of the bad stuff. And for those plants prone to accumulating nitrates like corn or sorghum Sudan hybrids used for forage, there are management tricks, like raising the cutter bar when harvesting. The lower stalks tend to have the highest nitrate concentration, so leaving them behind helps.
Oh, interesting detail.
Yeah. And any forage that might be high in nitrates should always be properly ensiled. The ensiling process can reduce nitrate levels somewhat and definitely test it before feeding. If you have to feed high nitrate forage, you need to be careful. Mix it with low nitrate feed, make sure the animals have plenty of energy in their diet because that helps the rumen microbes process the nitrates more safely.
Okay, pasture management is key. What about stored feeds, especially with those mycotoxins you mentioned?
Right, feed storage and handling for mycotoxin prevention. The goal is preventing mold growth in the first place. That means things like minimizing physical damage to grain crops during harvest. Damaged kernels are more susceptible to mold. Then, rapidly getting the moisture level down, ideally below 13% for grain storage, and keeping storage temperatures low. Mold likes moisture and warmth.
And for silage.
For silages, getting and keeping air out is critical. Packing it densely, sealing it properly. Oxygen allows mold to grow. Good hygiene during feed handling is also important. Don't cross-contaminate clean feed with moldy stuff. Simple things, but they add up.
What about those binder products people talk about?
Yeah, mycotoxin binders. They exist, and they're added to feed sometimes with the aim of binding toxins in the gut. Their effectiveness varies a lot, though, depending on the specific toxin in the product. And it's important to note, currently, no mycotoxin binder is actually approved by the FDA in the U.S. with a specific claim that it prevents or treats mycotoxicosis. So, use with caution and focus on prevention first.
Got it. Prevention is better than relying on binders. Any other key preventative steps?
Absolutely. Educate staff and minimize exposure. Train farm workers, make sure people handling the animals can actually identify common toxic plants in your area and recognize the early warning signs of poisoning.
Eyes and ears on the ground.
Exactly. Use fencing strategically. Keep cattle away from known patches of toxic weeds, especially during risky periods like after a frost or during drought. And just be sensible. Avoid feeding hay or silage that you suspect might be contaminated. If in doubt, test it or throw it out. Oh, and one more thing, often overlooked. Regularly check water sources. Sometimes high levels of sulfates or nitrates in the water can cause problems similar to plant poisonings or add to the overall toxic load.
Okay, that's a really comprehensive look at prevention. Now, let's try and connect this back. We've spent a lot of time on these often invisible threats in the environment impacting the adult cattle. But how do these broader issues, the plant toxins, the overall herd health management, how do they influence the most vulnerable members, those really fragile newborn calves?
Yeah, that's a crucial connection. The health of newborn calves is profoundly, deeply influenced by their immune status right at birth, particularly their susceptibility to widespread systemic infections, what we call septicemia.
Septicemia, that's blood poisoning, right?
Essentially, yes. It's a severe, often fatal, invasion of the bloodstream by harmful bacteria, triggering a massive inflammatory response throughout the body. And the single most common underlying reason calves get septicemia is an issue called failure of passive transfer, FPT for short.
Failure of passive transfer. Explain that.
Okay, so calves are born, believe it or not, with virtually no immune protection of their own. They have almost no circulating antibodies at birth. We say they're gamma-globulinic.
Wow, completely defenseless.
Pretty much. They are entirely dependent on getting antibodies from their mother through the colostrum. That's the very first milk the mother produces right after birth. They have to absorb these antibodies rapidly to get temporary or passive protection.
So colostrum isn't just food, it's their entire immune system kickstarter. What makes it so incredibly vital?
Exactly. Colostrum is an absolute powerhouse. It's way more than just milk. Yes, it's packed with immunoglobulins, antibodies, primarily IgG, which makes up like 85–90% of the total antibodies in there.
Yeah.
But it also has significant amounts of IgM and IgA, which help protect systemically and locally in the gut.
Okay, antibodies are key, but you said there's more.
Oh yeah, much more. Beyond antibodies, colostrum is a vital source of energy, protein, vitamins, minerals, but also this amazing array of other bioactive components. We're talking maternal white blood cells, growth factors that help the gut develop, hormones, cytokines that regulate the immune response, antimicrobial peptides that directly kill bacteria, antioxidants. The list goes on.
That's incredible. It's like a complete biological starter pack.
It really is. These components actively shape the calf's intestinal and immune development. They help good bacteria establish in the gut, and they reduce inflammation. It's nature's perfect first defense system.
Okay, this raises a really important question then. If colostrum is so critical, what can go wrong with this passive transfer process? Why doesn't every calf get enough? And how can producers even tell if a calf got enough immunity?
Right. Several critical things can unfortunately derail this process.
Yeah.
First and foremost, timing of feeding. The calf's gut can only absorb these large antibody molecules for a very short window after birth. Absorption efficiency is highest right after birth, and then it drops off rapidly after just 4 to 6 hours. By 24 hours, the gut lining basically changes. We call it gut closure, and it can hardly absorb any more antibody.
Only 24 hours, that's a tight window.
Incredibly tight. Peak absorption is even shorter, so getting colostrum in early is critical. Second, quantity of colostrum. Calves need a significant volume. The general rule is a minimum of 10–15% of their birth weight in colostrum. Ideally, that means about 4 liters or a gallon within the first 4 hours of birth, and maybe another 2 liters within 12 hours. This typically delivers the target minimum of about 150 grams of IgG.
Okay, timing and volume. What else?
Quality of colostrum. Not all colostrum is created equal. The concentration of antibodies, the IgG level, varies between cows. Good quality colostrum is generally defined as having at least 50 grams of IgG per liter. On farm, we often use a tool called a Brix refractometer. A reading of 22% or higher usually indicates good quality.
So you can test the colostrum itself.
Yes, and you should. Then there's cleanliness and bacterial contamination. If the colostrum is dirty, collected, or stored improperly, it can be full of bacteria. These bacteria can actually interfere with antibody absorption in the gut, and they can directly cause disease like scours or septicemia. Strict hygiene during collection and feeding is vital. Pasteurization can help reduce bacteria too.
Okay, hygiene is crucial. Anything else?
Calf figure and stressors. A calf born weak, maybe after a difficult birth, or one that gets chilled, it might not have the energy or the drive to stand up and nurse effectively soon enough. These calves are at really high risk of FPT simply because they don't drink enough colostrum quickly enough.
Right, so how do you check if the calf actually absorbed enough? You mentioned hiding the colostrum, but what about the calf?
Good question. The gold standard lab test is called radial immunodiffusion, or RID, which directly measures IgG in the calf's blood. But that takes time and a lab.
Not practical for every farm.
Exactly. So on the farm, we use quicker, practical tools. That same Brix refractometer can be used to test the calf's serum, its blood. The serum Brix score correlates pretty well with IgG levels. Another common tool is a total protein refractometer, also using serum. It's useful, but you have to be careful because if a calf is dehydrated, its total protein can look falsely high, masking FPT.
Ah, okay, but a potential pitfall there.
Yeah, there's also a simple rapid test called the sodium sulfite turbidity test. It's pretty specific for detecting low antibody levels, indicating FPT, and can be done right there on the farm.
Okay, so there are ways to check. It sounds like this whole process is a complex dance that really has to go perfectly right in that first day of life. So if it doesn't, if a calf misses out and has failure of passive transfer, what are the real-world consequences for the calf's health and for the farm's bottom line?
The consequences are profound and honestly quite costly. FPT is directly linked to a significantly increased risk of sickness, morbidity, and death, mortality, especially from common infectious diseases that rely on those maternal antibodies for protection, things like calf scours, diarrhea, and bovine respiratory disease, pneumonia.
How significant is the risk?
It's major. Mortality rates for calves confirmed to have FPT can unfortunately range anywhere from 8% up to as high as 25%. That's a huge loss. This lack of immune protection, this vulnerability, means that even common bacteria normally present in the environment can just overwhelm the calf's immature defenses.
Leads to more sick calves needing more treatment.
Exactly. It directly drives up the need for antibiotic use, which then feeds into the larger concerns we have about antimicrobial resistance.
And the cost.
The economic burden is substantial. Studies have estimated the cost of FPT, considering treatment costs, calf loss, reduced future productivity, to be anywhere from 60 to 80 euro per affected calf. That adds up fast across a herd.
Wow, okay. Now, what's really fascinating here, and where this conversation started, we began this deep dive talking about those hidden plant toxins. How does that circle back to these vulnerable young calves struggling to get immunity? Is there some surprising interplay between these two seemingly separate issues?
There absolutely is. It's a critical link. As we established, FPT is recognized as the single most common predisposing factor for calf septicemia. No antibodies, defenses are down, bacteria get in. Simple as that.
Okay.
But here's the connection. Certain plant toxicoses, and particularly those mycotoxins we discussed, the fungal toxins found in feed, can directly impair the animal's immune function
How do they do that?
through various mechanisms. Some mycotoxins can reduce the animal's own ability to produce antibodies later in life. Some can directly damage immune organs like the thymus or lymph nodes. They basically suppress the immune system.
So even if a calf gets some antibodies from colostrum.
Exactly. This immunosuppression caused by toxins makes calves even more susceptible to bacterial infections like septicemia, even if they manage to get some level of passive transfer. It lowers their defenses further.
Yeah, I see. It's like a double hit.
Precisely. So you can have this complex, damaging scenario where multiple stressors converge. Maybe the calf had borderline FPT, and it's exposed to mycotoxins in its feed or from the dam. And the combined effect severely compromises its health, making it much more likely to get sick. It really highlights why you need a holistic, integrated approach to manage herd health, looking at everything from pasture to colostrum to feed quality.
We've really taken a deep dive today, haven't we, into this multifaceted world of cattle plant toxicosis. We've gone from identifying those hidden dangers out in the pasture to understanding their specific, sometimes really shocking effects on the animals. We've explored the critical role of diagnosis, that detective work, and why proactive prevention is just so key. And then how a calf's very first meal shapes its entire immune future, and how that unexpectedly ties right back into the broader challenges of toxins and herd health.
Indeed, I think the insights from the research really underscore that protecting livestock health requires this comprehensive, interconnected view. You can't just focus on one thing in isolation. It's about integrating rigorous pasture and feed management, absolutely prioritizing those stringent colostrum protocols for newborn calves, and just staying constantly vigilant, looking for those early signs of trouble. By understanding these complex links between the environment, the feed, the mother, the calf, the immune system, we can genuinely make a difference in mitigating the health problems and the economic losses in our herds.
So think about those silent battles being fought out in the pastures every single day, where a simple plant's natural defense mechanism can become a farmer's biggest headache, and how the smallest calf's very first drink, that colostrum, literally dictates its chance at survival and impacts the health of generations to come. What new perspectives does that give you on this intricate web of life and just how critical it is to understand the environment that surrounds us and the animals we care for?